Hello, dentists and Hopkinton patients. Hope you're doing well. We wanted to let you know that we will be opening for non-preventative care. So any care that's not cleaning is on May 18th. So if you've been waiting to have your teeth worked on or you're having some mild issues, you might want to call us to make an appointment. I'm going to walk you through our new procedures, just in case you've been wondering about the dental office. So when you first come to our office, we're going to ask that you take a pump of hand sanitizer. And we also have some tissues here for you and a waste paper basket underneath. And you should be sure to wear a mask to our office and do not remove it until you're in the back of our office in the operatory. The other things we've been doing are we're installing barriers at our front desk because we will have staff working here and we'll have minimal contact with them, but we will be here to answer your questions. If you come into the office and your hygienist or dentist isn't here to take you right back, we'll ask that you take a seat in the waiting room. We have spaced the chairs 6 feet apart and you keep your mask on. And when your dentist or dental assistant comes up, we will be taking your temperature with our contactless forehead thermometer. So let's go back and we'll take a quick tour of what we have going on in the back. So you may see us, we're gonna look a little different. We're going to have on surgical caps throughout the day, longer lab coats or surgical gowns. We'll be wearing N95 masks with another mask over the top. And when we're drilling or using any procedure that creates an aerosol, we'll be wearing a face shield. All of this stuff is for your protection. We're gonna be using more barriers, more plastic barriers. And also we have purchased healthy air filtration machines. So this is an example right here. This will filter all of the aerosols that from the drilling or the ultrasonic scalers that we use.
Okay.
So you're a general dentist, am I correct?
Yes, I'm a general dentist.
Awesome. That's the coolest specialty I can think of. We do everything. So tell me a little bit about your practice.
So my practice is a group practice. There's 3 general dentists and we have a periodontist as well. 4 hygienists. We've been around since 2003 and it was founded from scratch in Hopkinton, Massachusetts. I used to work in Philadelphia before I moved back from Massachusetts originally. And it's been a great practice. It's been a great run and hopefully we can survive the COVID emergency.
So you said you started it from scratch, am I correct?
Yes.
So what was that like? What is it like starting?
A little bit scary, but I was pretty young and I always said, if I don't make it, I'm young enough to do something else or work for someone else. And I think I was 28 when I started. So I worked for 3 years, decided I could do this better, let me do my own practice. Yeah.
Was there something specific that drove you to start your own practice? I mean, you said you worked in Philadelphia as an associate, correct?
Yep.
So was there a specific incident, a specific factor that drove you to start your own practice?
I would say maybe lack of oversight. There were too many people doing what they wanted in dental offices, especially staff issues, staff problems. I also worked for a DSO that it was the owners that just sold to DSO. And I watched the practice just go downhill. They were hiring people that weren't trained. A lot of the patients were leaving. So it was really interesting to watch. And I was on a salary, so it was good for me at the time.
And what was the scariest part about starting a scratch practice?
Just the money you're taking on, the debt, and knowing that you have to pay that back no matter what. That's scary. And then your student loans on top of that. So you have huge debt from school. And now I had the type of student loan that ramped up over 3 years. And now my loans ramped up and now I'm paying a debt for a practice on top of it.
When you started your scratch practice, are you leasing the space? Did you buy the space?
Leasing the space. I'm still leasing the space.
And, you know, starting out with student loans, I did a scratch practice. So, you know, I know the stresses, but I want to hear your perspective. were you worried that you were going to be able to afford to pay that lease? Were you worried that you'd be able to afford to pay your student loan and also make a living, right? I mean, you got to eat.
Yeah, I was always nervous, always worried. I'm sure it's much worse for new grads now, but I was still really worried back then, but I knew that I was young and I had time to mess it up.
Where did you go to dental school?
I went to University of Maryland and I graduated in 2000.
Very nice. That's the oldest dental school in the nation, am I correct?
First dental school in the world.
Wow. And what did you thought about specializing at all?
I did. I really liked endo when we were taking the course. And then I went to rotate through the clinic and I fell asleep. So I said that I can't do this.
Okay. Do you do endo now?
No, I did when I first started. I limited it to anterior bicuspids, easy things that I could do. I tried a few molars early on, and then I just realized after I've been practicing for a while, I really enjoyed doing surgery type work more. And so I didn't do any more endo. Yeah, but then we have a periodontist. But I realized over time, we were still referring out a lot of extractions that I could do because I wasn't trained in doing bone grafts. So I went back to school to do that.
Now, you mentioned that you're, you've got a couple of associates and you have specialists, coming in. What made you decide to bring everybody in, and what were the factors that helped you grow your practice to the size that it is right now?
So first associate, I realized I couldn't keep up with the new patient flow. I was still working full time and I didn't have any kids yet. But then I got pregnant with my first associate, not her baby, but
I was going to be like,
was there.
the best interview ever. Tell us more about that.
So that helped me go down to 4 days a week to be able to handle that. And then from then on, it just kept growing. Then we added another associate, more hygienists. And I feel like at this point, this is about all I can handle. I don't think I can get bigger. I don't want another office. You have multiple offices. I think that's a lot of work. Yeah.
Well, I think one office is a lot of work. I think dentistry is, this is supposed to be your interview, not mine, but I'm going to add this. Dentistry is very labor intensive. It is not an easy job. Now, what do you think are the factors that made you successful, made your practice successful? Why are people coming to you?
I think that one of the factors is I grew up close to the area where I work. So I draw some people from where I lived prior. I feel like people are drawn to us because we act like real people. We're not high and mighty. We try to work with all our patients to get the treatment done. And I think patients appreciate that. We're super organized. We always get back to people. Customer service is our #1 goal at all times. And, the longer you're in practice, hopefully it's getting better over the years. You're refining your systems and you're, treating people better and you're growing, and it's tough, but it's great. It's a great job.
When we, at least when I went to dental school, there was very little practice management training. Mm-hmm. Now, you're super organized and your success is obvious. So the question is, where did you learn all these skills? Where did you get it from?
I think a lot of us are organized just from getting through school. There's a lot of barriers set up along the way. So you have to get into college, then you have to get into dental school, then you have to pass dental school. And, setting up a practice, not everyone can do that. So by the time you get through those things, you have to be very organized. It doesn't work out very well, I think, if you're not, or if you're not, you need someone else to help you to be organized. Yeah.
There are practices out there that were struggling, mm-hmm. and there will be more practices that will be struggling with the current environment. And we have our colleagues that have just graduated from dental school. Some of them are looking to become associates, and some of them eventually want to be owners, and some of them are being told you can never be an owner. You just can't.
People told me that back in the day.
Right. So what's your advice to, your colleagues that were struggling or may be struggling, and what's your advice to new grads as to what they should do? Should they own a practice?
I think they should own a practice. I think they need to sit down and really think hard about how they can be successful in this business. And it may not be practicing in a saturated area that's full of dentists. And Massachusetts is full of dentists. There's definitely some areas that are more rural, but you need to weigh everything. Can you make a living there? Are there enough people that need care? Or are you going to need to move? It's not always a bad idea. You don't want to struggle your whole career to make it work. But that being said, you might find a practice to buy where you want to be. So you have to really think about it.
Did you move, and how many dentists are there in your town?
Did I move?
Yeah, did you? I mean, you grew up where you were, and then you were in Maryland. So did you specifically move to your town, back to your town, because there were few dentists? I mean, what was the reason why you went back?
So I picked Hopkinton because I was looking to live near Boston. My husband works in Cambridge. He worked in Charlestown at the time, but we knew he'd always work in biotech or in bio somewhere. And so we needed to be close to Boston. So that helped me narrow my search down. And Hopkinton just happened to be what I did my business project on in dental school. We actually had business courses at my dental school. So I used the same business plan to start my office that I had written in dental school.
That is so cool. We never had that. What year did you graduate? You don't have to tell me if you don't want to.
2000.
Okay, so you're a baby.
No.
Yeah, you are. I'm 2002, so we're both babies. Okay, so I want to move a little bit towards the current circumstances that we're all facing. Without getting into details, how do you see the future? How do you think dentistry is going to survive all this?
I think right now we're going to be in sort of a panic mode.
Are you in panic mode?
I was in a panic mode and I bought a lot of stuff.
I saw. And we're going to show that video in the interview that you had. So you were in panic mode. So you're not in panic mode anymore.
No, I'm not in panic mode now. I was in panic mode. Maybe I bought some things I probably didn't need, but I thought I was getting a $10,000 grant, but I never got the $10,000 grant. I did get the PPP loan. Okay. So that will be very helpful in the next couple of months. I think now we just need to figure out how do we get back to work safely. I've been working on patients, so I have a feel for it now. It's hard. It's hard work working with all the PPE on, and if it's hot outside, you better make sure your AC is working in your building because you'll be sweating like crazy.
So what sorts of stuff did you buy?
I bought, before we even closed down on the 16th, I had already purchased face shields because I knew that we would definitely need face shields. I was already using them for surgery, but we needed some that were maybe not disposable. So I went to Home Depot, Lowe's, I took all their face shields. I tried to scrounge up some N95 masks, and I got a few. I was successful with that. Some people have them laying around in boxes in their houses too, from different projects they've done. Bought the masks, bought the face shields. Then I bought these healthy air filtration systems. They have a hose that goes up under the patient's chin, and it will suck all the aerosols away from where you're working. And I picked this system because it has a very big HEPA filter, and they put a charge on it so that it can remove more like smaller particles. So hopefully that is really working. It seems like it's working. I've tried it. So it gives me a little bit more peace of mind with having that plus all the PPE. I installed it in washer and dryer in the office.
Now, I got to see the HEPA system that you had, the filter. Mm-hmm. Do you mind sharing with everybody where you got it from and whatever information you want to share? Right?
So yeah, Healthy Air is the manufacturer. I think the place I bought it from is called Healthy. I can't remember. It's like Healthy Dental Solutions, or I can get you the info. But the guy that works there is really nice. He went over the technology with me, and they still had them in stock at the time that I ordered. So anyone that's doing an aerosol procedure in my office will be required to use that filtration unit.
Now, you're very, very passionate about dentistry. You're very vocal. I see you on Facebook all the time. I'm fortunate we haven't gone to an argument, which is good, but it will happen someday. You know, you're very supportive, and you're very supportive with our initiative in terms of providing emergency care. But I don't want to talk about Dental Cupid. I want to talk about you. Tell the audience, regardless of whether you're in big practice, small practice, what are some of the factors that are going to affect dentistry in the future, in your opinion? And what do you think we should all be doing to protect the profession and protect the patients?
I think we need to advocate for dentists and small business owners. Definitely patients. A lot of what's the best for our profession is a mutual benefit between the patient and the doctor. So I think we need to do that. There's a lot of interests out there that are not acting in our best interest. So we need to really be wary of that and promote independent dentistry. I think it's the best way to treat patients.
Now, I'm sorry, but I'm going to push you on some of these topics. So let's talk about somebody who's mid-career. I want to think of myself as mid-career, okay? What should I be doing for dentistry? And why is that good for me, for my livelihood, for my practice, for my patient? What should I be doing?
What should you be doing for patients, or?
No, for dentistry, for our profession, which I always like to think whatever's good for us is good for patients.
Right.
And I hope you agree.
Yeah, I think so.
What could somebody like me be doing?
What could you be doing? I think you could be, well, you do a lot already, right? You're doing Trustee at Mass Dental Society. I would say fight for what's right for patients. Some of these insurance companies are just, they're not dental insurance. They're not insurance. And that's a big part of our business. And over the years, they reimbursed less and less. They create a lot of administration work for us. I mean, that's one of the problems. We have to pay so many staff just to be calling insurance all the time when we could just be focusing on patients. And it's so confusing.
What portion of your payroll, just a guesstimate, would you say is attributed towards billing and benefits management?
So out of 17 staff, there's probably 1, 2, 3, 4, 5 working on it.
Wow, that's a lot.
They may be working on other things, but they all have their hand in it in some way.
Now, somebody who's mid-career, you've already given me good advice that I should be working towards advocating for our profession against, difficulties in collecting patient benefits. Would you say that's something I should be advocating for?
I think so.
For new grads, right? You come out, and I'll be interviewing a new grad later on. They're coming out with $200,000, $300,000, $400,000 in terms of loans. That was you and me, many years ago. What should they be doing? Do you think they have time to advocate? Should they be advocating? No.
They need to get out there and work. They should probably get a few jobs and really work as hard as they can. But unfortunately, they have the debt. They have to pay it off. If they work a lot in the beginning, they can learn about setting up a practice or buying a practice. I don't think working for a DSO is good for them long-term necessarily, because I think your growth is limited. So it's going to take you a really long time to pay off the debt.
So, if I were a new grad, do you think it's still possible for me to own my own practice?
I think so. I think a lot of people will be retiring. They had put it off for a while. I think it's possible, but you have to get out there and look and really network. You'll find it. You definitely will find it.
Now, associates, do you have any young associates working with you?
I don't have any young associates. I'm the youngest.
So what are the benefits of an associate working for your practice? Are there any benefits?
For them?
Yeah.
Oh, yeah. Yeah, I think I pay very well. So I think that's another message for practice owners. You can't pay people badly. You have to give them a good salary and good benefits and, you know, good working conditions, because then your associate won't stay. And now you're, you know, you're getting frustrated and you don't end up selling to anybody.
What are the threats to your practice? I mean, what is the biggest threat out there right now to the survival of small business, if you want to call it?
Well, I would say COVID-19 is a big threat right now. That's a huge threat because it's going to change how we practice, and we may not even be profitable. It may be really difficult. But after COVID, I would say it's insurance reimbursement. That's the hardest. If you're going to stay in network, you have to make a profit. There's no way around it. You can't be negative or zero. You have to be making a profit to stay in business. And you can't shift all the cost to your cash and your out-of-network patients, because that's not really fair either.
I hear the tone of your voice go down as I ask that question. Is this stressing you out, Jill? Honestly?
Is it what?
Is this stressing you out?
Yeah, it definitely has stressed me out over the years, because it's just so much work and effort to keep watching these figures drop. And I watched at the beginning of the year after Delta reduced our compensation 8.8%. I looked at January and February. It was a pretty good drop, even though we were busy.
What makes you happy, Jill?
Probably my kids and my dog, my husband.
What do you do for fun? Tell us more. Tell us more about your.
We used to travel a lot, but I would say most recently we went on a ski trip. That was fun. Hanging out with our friends, exercising, just whatever. Now it's different, but it will go back to normal. You know, everything will go back. I mean, we have to wear masks now and again, but honestly, my husband was already wearing masks when he was traveling before COVID.
Did you travel to Asia a lot? Because they've been wearing masks forever.
Oh, I've only been there once, but everyone wears masks. Even in the summer, they have masks on because they don't want to get a tan.
Well, in 2002, 2003, they actually had the first version of SARS occur there. Mm-hmm. And they actually learned a lot from that experience. And I wish we would have implemented universal masking a lot earlier. But
oh yeah, especially this time around. I wish they had said wear a mask instead of don't wear a mask. Like, that didn't make any sense at all.
Well, so Jill, we learned a lot from you. Mm-hmm. If dentists watch this video and they want to contact you and ask you questions, sure. Are you open to that?
Sure. Yep.
Okay. Do you have any parting words for all of us? And we're definitely going to come and catch you maybe in a month or two, mm-hmm. and learn more about how the current circumstances have affected your practice. But sure. We definitely want a diverse spectrum of views and ideas. Right. So, you know, we can all go through this and we can all learn. And it's not just the virus. You know, we should be learning from one another. We should be benefiting from one another. And I think we're one profession and we're one team.
Mm-hmm. So I would tell dentists, just know that you're valuable in society. Don't let people make you think you're not. Make sure that you're being compensated appropriately. And we have a risky job. So it's not just, you know, it's not just the amount we're getting paid, and we're putting our lives on the line sometimes when we're working, especially with COVID. So be really careful and remember that, you know, what you're doing has a lot of value.
Thank you, Jill. Really, really appreciate your time. And I will definitely put up your contact on the bottom of the interview. And thank you for your service to dentistry. We really appreciate it. And we need more people like you. Okay. You have a lovely day, Jill.
Thanks, you too.
Thank you. Bye-bye.